Dr. Stanger from Copenhagen. I'm the father of Otovent, and I've been asked to tell you about how I designed the Otovent. But first, I need to tell you some background information on this. So I'm going to show you some slides. Yeah. I used to be associate professor in Gentofte University in Copenhagen, Denmark. And like many other places in the world, we did a lot of epidemiologic studies and found out that OME is an extremely frequent condition. It's a huge problem. And what can we do? Adults, in case of eustachian tube dysfunction, can do a Valsalva maneuver to try to clear the negative pressure in the middle ear. And next slide, please. Many children are not able to do this effectively. So what to do? Since 1954, a ventilation tube was reinvented, and it's a very good treatment because it clears the negative middle ear pressure momentaneously and restore the hearing momentaneously. But this is not without problems. And next slide, please. First of all, the child has to come into general anesthesia to get the ventilation tube. It takes about 1 minute. Then in many cases, about 20% of the cases, there will be some purulent discharge in the follow-up period. Usually the ventilation tube will be in place between 6 and 10 months, and then it will passively be extruded into the ear canal. And in about 5 to 10% of the cases, after extrusion, there will be a permanent perforation that needs surgery later in life. It depends on the type of ventilation tube. Here we could see that what I said before, that about 80% of all children experience at least one episode of OME before school age. Next slide. And next slide. About half of these are short-lasting periods, less than 3 months. And next slide. But in half of the cases, the OME or dysfunction is long-lasting, more than 3 months. And this gives a hearing impairment about 40 dB. Next slide, please. What we found out from the studies was there was a very great seasonal variance. Those children who had OME at one visit, 3 months later, the effusion had cleared spontaneously. In some cases, it was still there. So this gave us the treatment strategy to observe for 3 months, and if still effusion after 3 months, you could put in a ventilation tube. So what to do in this 3-month waiting period where the hearing will be impaired, but there's also a chance of spontaneously clearing. Next slide, please. We also know from the studies that basically all eardrum pathology is found in patients who had long-lasting OME in childhood. And next slide. We also know that those children who always had normal middle ear pressure, they will not develop any eardrum pathology. Next slide. So in order to try to have a treatment option in the waiting period, but also to try to stop some of the overtreatment of ventilation tube, which became very popular. In Denmark, about 60,000 ventilation tubes are put in every year, and in some children up to 11 times. So in 1988, I made a prototype in my workshop at home. And next slide. And we set up a study in a private ENT where we took 100 children with long-lasting OME or long-lasting negative middle ear pressure between minus 200 and minus 400 C2 type tympanometry. And they were observed for 2 weeks, or they were asked to do autoinflation for 2 weeks. And next slide, please. So this group, the ones, they didn't have glue ear, but they had significant negative middle ear pressure. And we know that is, in many cases, like a pre-stage of OME. And we could see, if you look at the left column, 14% with C2 cleared to normal tympanometry, 62% still had negative, but 1/4 of the children, they developed OME during this 2-week observation period. Compared to the autoinflation group, you can see that only 5% deteriorated and developed effusion. And next slide, please. If we look at the group that basically qualified for ventilation tubes, they had had OME for at least 3 months. So just after 2 weeks spontaneous observation, 15% cleared the effusion with no treatment. So they would have been overtreated. In the autoinflation group, half of the children cleared the effusion and didn't need ventilation tubes. Next slide, please. So our conclusion was that if autoinflation is started early during eustachian tube dysfunction, the C2 or C2 tympanometry curve, we can reduce OME in about 80% of the cases. And next slide. And in case of established OME, we can reduce the need for ventilation tubes with about 50%. Of course, the children should be so old that they are able to inflate the balloon, and it's 3 to 4 years of age, depending on the parents too. Next slide. Yeah. So from the design of the Otovent in '88, it was quite difficult to get it commercialized. I had the study, but in 1991, a Swedish company called Abigo took the Otovent and put it into the market. Thank you. After many years of clinical experience and also personal experience during travel, it is very common to hear people crying with ear pain during descent in civilian air flights. So therefore, we decided to try to find out the point prevalence of barotitis during flights. So we set up a study where we were 3 doctors in Copenhagen Airport and 3 doctors in London Heathrow Airport. And every day there is 4 flights from Copenhagen to London and 4 flights from London to Copenhagen. So in the airport, we had tympanometers, we had otoscopes and questionnaires, and we examined people at the gate before takeoff. And in half of the flight, they were randomized for Otovent flights, where there was people had, after instruction by the stewardess during takeoff, they were asked in case of they felt any problem during descent, they should try to do an Otovent inflation. So first, a little physiology. You can see here to the left, I have drawn a middle ear before takeoff. There'll be 1 atmosphere inside the airplane, outside the airplane, and inside the middle ear. And next slide, please. During ascent, when you go up, the ambient pressure will be falling, but because there's a pressure cabin, there will be less problem. But the air pressure inside the cabin will decrease to about 1/3 of an atmosphere. So relatively there will be a hyperpressure in the middle ear. But because of the eustachian tube works like a one-way valve, this hyperpressure will easily clear out. And next slide, please. During the cruise level, there'll be stabilized 3/4 of an atmosphere inside the middle ear, but also inside the airplane. Outside the airplane, there'll be 1/10 of an atmosphere. And then after some hours, next slide, please. During descent, the pressure will be increasing. So this gives a relatively negative pressure inside the middle ear. And because of the one-way valve, it can be difficult to clear this pressure, even by forceful Valsalva. And next slide. So after landing, you can have a condition called barotitis, where you have effusion and blood in the middle ear in adults and children. So we wanted to try to see how common is this. Next slide, please. Yeah. So when the passengers left the airplane, they were asked to be re-examined, where we measured the middle ear pressure. In case of negative pressure, they were instructed to do a Valsalva maneuver to try to clear this negative pressure. It could be a very slight negative pressure, not clinically relevant, but if you have a slight negative pressure, you will usually be able to clear this by Valsalva. And next slide. Of these 86% of the air passengers that had a negative pressure, about half of them could clear the negative pressure by Valsalva. And next slide, please. Those who couldn't clear the negative pressure by Valsalva were asked to inflate an Otovent. And in this case, 70% of those who couldn't clear the ears could clear it. And next slide. So in conclusion, we found a very high, from the questionnaires, there was a very high correlation between previous and actual ear pain during flight. Those who had experienced ear pain during previous flights, half of those had ear pain during the present flight. And about 10% had otoscopic signs of effusion in the middle ear, and this was all in adults. 18% had negative pressure after flight, and 46% normalized the pressure after Valsalva, and 85% normalized the pressure after Valsalva and Otovent inflation. Thank you.